Yes, post-traumatic stress disorder occurs when individuals are exposed to overwhelming traumatic circumstances that might involve actual death or threatened death, or actual physical assault, or attacks on physical integrity. And people can observe this or actually experience these sorts of things to develop post-traumatic stress disorder, or they might even hear that it's happened to a loved one and may develop PTSD. Other people might develop PTSD as a result of the work that they do, say ambulance and police, individuals who are exposed to horrific scenes on a regular basis. Look, it's relatively common, affects about 4 to 6% of the population in any 12-month period. Clearly it affects families, particularly given the effects it has on the individual. So individuals who are experiencing PTSD will experience intrusive symptoms, what we call intrusive symptoms. These are flashbacks, nightmares, intrusive memories, where the person experiences physiologically what they experienced at the time. So, of course, this is going to have an effect on loved ones, etc. In addition, the individual with PTSD will avoid all sorts of situations and cues that remind them of that particular event. And the sorts of things they may avoid are not just physical situations. They may be smells, they may be sounds, they may be anything to do with the traumatic event. In addition, there are often emotional changes with post-traumatic stress disorder. There's increased aggression or irritability. There's changes in the way the person feels, in that they may feel guilt or shame, or just feel overwhelmed a lot of the time. Look, post-traumatic stress disorder requires some skill in treating it effectively. There are some medications that may be helpful in the treatment of post-traumatic stress disorder, but again, cognitive behaviour therapy is the treatment of choice, with imaginal exposure to the actual trauma to help the individual integrate what they weren't able to integrate at the time of the trauma.